Hello and welcome, everybody. We are going to be talking today with Dr. Earl Gray and Dr. April Crable. And I'm Dr. Sarah Stewart Spencer, your host today, as we discuss CliniVRSE. So right now, the education world is making a big shift as we see that online education and options in the past were kind of a side thought, but now online education is becoming a predominant force and looking for new innovative tools that enhance clinical decision making and that look at practical applications and competency-based learning. These are all the craze, and so that's why we're here today, going to make some explorations in this new tool. So let's dive in. What was the aha moment that led to the conception of CliniVRSE?
Thank you for the question, Sarah. So, at a period of time well before we were zooming, if you will, in online education, both April and I had been working in online education. And in a typical process in online education, skills are taught in terms of what the skill is and how to demonstrate the skill. And over years of observing, I was in a director position and realized that we never really take the time to teach students or new clinicians how to make a decision which skill to use next in the immediate, in the session. We talk about the purposes of the skills, the structures of the skills, how to demonstrate those skills, but we don't actually say, and this is why you would use this skill in this moment with this client. And to me, I saw that as a gap in kind of the learning for students. I call that clinical decision making. And so the product CliniVRSE itself was designed to, in an asynchronous way, fill that gap. So students will still participate in learning what a skill is and how to demonstrate it, and even in role plays. But those additional moments where you have to think on your feet, CliniVRSE gives opportunity to students to actually have that moment, sit back and think, which would be the best skill to use here, and then select that skill and move forward. And with CliniVRSE, we thought about it and really recognized that it needs to be more than a moment. We need an experience of treatment, because that's the other area that is missing in education in general, where we're not necessarily working with a client through treatment until we're in our experiential process, practicum or internship per se. And so the other element that we use CliniVRSE to help expand on is each module is 10 full hour-long sessions, where a learner would go through each session with the same client, same issue, but they're working through a treatment plan using their foundational micro skills and deciding which one's best and learning along the way. That was the other element, that in vivo feedback was missing as well. And so in CliniVRSE, there's two modes. Students can go through a practice mode or a test mode. In the practice mode, a student gets an explanation on what their choice was, which skill it was, how effective it may have been given the context of the session, and how they may restructure that somewhat differently if it wasn't the best option. So it's added a level of immediate feedback that is, quite honestly, humanly impossible for every single student in any type of program, really. So that was really the aha moment, is really realizing there's this gap, and then how can we fill it?
I almost hear a little bit, you talk about purpose and how, and it's not just here's your knowledge, use it. It's how do I use it? What's the purpose behind when I use it? How is it placed? There's a big piece to this missing how that you two have filled. Awesome.
Yes.
Yeah. I also want to just add to what Dr. Gray said, that really appreciated that we were discussing about students in this process. Like, they always was the forefront of our conversations. And part of what we noticed was that some of our students were they had a lot of anxiety about doing role plays with their peers. And this was an opportunity for them to practice asynchronous, as Dr. Gray mentioned, and kind of build that confidence up too, and learning these new skills and not having to, some people have that performance anxiety is what we call it sometimes. And so this CliniVRSE allows them to, hey, let me practice outside of with my peers or outside of the course room. And we really thought that this was also a great way for them to be able to kind of address some of those anxieties that they were feeling, or at least decrease some of those when it was time for them to be in front of their peers practicing.
Incredibly student-centered in that way. You both thought about the anxiety and the pressure they feel to even perform in their development. So giving them another option. The name, okay, CliniVRSE, I've got to know, is there something behind it? How did you come up with that? Tell me about it.
Yeah, so I think that was really a joint effort coming up with the name. We knew we wanted it to be clinically based in the title, so that's where the clina starts. That stands for clinical. And then as we were working and developing the product, we were working with different publishing companies and different technology companies, and the company that actually coded CliniVRSE is a virtual reality based company. And so that's part of why we included the virtual reality element into our product. And then the other element for the simulated education part, this is really simulated education. You're not role playing. This isn't a novice person trying to play a client. This is a trained professional actor or actress performing the client through a script. So you get much richer emotion, richer inflection, richer depth.
So let me pull out a little bit, and that is this discussion around really enhancing learning. And I think there's a myth of asynchronous work and this really elevated sense of learning go hand in hand, but I hear that was your primary focus. So tell me more about how the asynchronous nature really does enhance learning here.
So yeah, with the asynchronous, what we decided was that this product is created by counselor educators, right? And we said, what better way for us to be able to develop these scripts to make sure that students are actually learning all of the skills by giving the emotions, doing just real life situations that most students cannot gain just doing the mock sessions, because it is difficult for students to have the mock sessions. So the way that it works, what Dr. Gray was mentioning, was that students can log into their portals, right? They work through the simulated sessions. They get an opportunity to choose what the next response would be without any prompting, without saying, hey, practice reflection of feeling. They have to decide, hey, which one works, like that clinical decision making process. And what they choose, they get a real life response of, hey, this is why you chose this. This is what most counselors would, but they don't say, well, your answer was wrong, or no, but this is what happens if you chose this response. And then at the end of the simulation, the process, then they get a score, right? And then that score is how well they did based on the responses they provided. And Earl, if you want to go, Dr. Gray, a little bit into details about how it's scored, that would be great.
Sure. So, it's scored on a weighted Likert scale. So there's the best answer, an acceptable answer, and a less than acceptable answer, if you will. And so the scoring is weighted. So the highest, I believe, is a 5-point item, the middle is a 3-point item, and the bottom is a 0-point item. And so once you go through a whole session, which each session simulates about an hour of counseling, you get a score for that session. And it identifies the number of best answers you chose, and you get a score for that. You get the number of moderate answers you chose and a score for that. And then how many of the less than acceptable answers you chose, and you get a score for that. So that score sheet, out of doing it, is really the tool where both students and faculty and or supervisors can really assess and work with students in developing improved learning in their skills. They could each supervisor or faculty member or university or program could determine what their baseline scores might be. And then students could go in there over and over and over again until they improve. There's no faculty grading other than the scores, automatically grading. Faculty don't have to watch videos. And it's all structured in a way that the score that's outputted is automatic based on what the student responded. So it's a built-in process.
I hear a lot of goodies for agencies and institutions and universities. I heard consistency. I heard a quick response of feedback. I'm hearing a lot of good things. One of the things that both of you have mentioned is this real situations, that it's not something that a role play in the moment somebody just came up with because they saw something on a Netflix series last night. It's a real situation. How did you guys ensure that these situations are so authentic and beneficial to the student?
So that starts with, go ahead, Dr. Crable.
I was just going to say it started with a conversation with Earl and I, just thinking about just what would students have to experience? What kind of clients would they encounter, practicum and their internship or the experiential experience? And we wanted it to be as real life scenarios as it could be. And one of the things that we really talked about was the fact that when does a student get an opportunity to actually sit in an hour session prior to practicum or internship? They really don't in a real life clinical session. And so we wanted to make sure that we created that for them to be able to have that practice, to know what it's like to even sit still for 50 minutes and work through a session if they wanted to. And so, Dr. Gray, what were you going to say?
Yeah, so picking up on what you just said, we in developing CliniVRSE, we really thought about what was realistic as well. So there's some of those skills that aren't necessarily taught, like sitting with someone for 50 to 60 minutes in a counseling session that otherwise may not happen. We also considered the foundational micro skills, our person-centered foundational micro skills. And we decided to use scenarios that wouldn't require greater intervention than our foundational micro skills. Both basic and advanced micro skills, but micro skills nonetheless. So that way, students, at least in this first series of modules, students don't have to have extra education in some specific therapy or specific theory. So it's very, the approach is designed around a generalist approach for those who have issues that aren't at such a clinical level that requires high level of intervention. So it really capitalizes on any synchronous learning or even digital asynchronous learning a student may be getting, to then they can apply it through this process.
There's that application piece coming out again. So you have been, I can imagine, up to your necks in development and working to improve it and kind of getting that technical piece and working together with your team. Tell me about some success that you've seen that has kind of stood out with using this or having users come in and test it.
Yeah, so those who have used it and practiced with it have found it greatly helpful. We had one individual who actually purchased multiple series just so their other clinicians could experience the product. What some of the feedback we received is that it fills lots of gaps, more gaps than we even realized it may have closed, if you will. I spoke about the gaps around the clinical decision making in the moment, in vivo feedback, a decrease in faculty grading and faculty time allocation. But we've also found that it is having an impact on the therapeutic alliance process, where users are understanding that, oh, if I use this skill or say it this way versus this way, I might improve my therapeutic alliance. Or if I use this version, I might rupture my therapeutic alliance. So those are some of the elements that we've got feedback-wise. Dr. Crable, what else would you like to add?
The other thing that we hadn't really talked about at the beginning of this was the remediation piece for students. too, that we could use this for students to be able to remediate skills that they were having difficulty with. The other piece was using it at the beginning of prior to internship and practicum to assess the readiness of skills. And so those are kind of things that were kind of like, oh, these are good things that we could add that we wasn't even thinking about before. And some of the things that some other feedback that we had with the faculty that use it with their students, where they really enjoyed the idea of them being able to do this asynchronous, like to just pick it up maybe throughout the day, maybe 30 minutes, an hour a day to just practice their skills in between time, in between courses, because we know that for some programs, they get skills at the very beginning and then they're not applying those skills until the very end. So that's also another gap that they can use CliniVRSE to be able to just practice along the way to be able to have that readiness for a practicum internship.
How do you measure success with CliniVRSE?
I think there's some great opportunity in how that's measured and some creativity the user, the supervisor, the faculty, the program could have around that. So the structure of CliniVRSE is that score sheet, you know, kind of which options did you use? How effective were they? Using CliniVRSE as a pre and post opportunity for assessment could be a way to really measure the success of a student. Also using those scores as endorsements, if you will, or benchmarks, as evidence to potential sites for students or employers for those who may be searching for employment. Those are other ways to measure success for students using CliniVRSE or learners using CliniVRSE. Dr. Crable, other thoughts?
I think too, we have all been there, right? To where we've been in a practicum course or an internship course, and the students say, well, that skill wasn't taught like that. That's not what that professor said. And I think what it does is that it unifies. It really kind of conforms. Hey, this is what this skill it looks like, and everybody is teaching it. And there's the consistency across the program of that. You have students who say, well, you know, immediacy is not that. And you're like, well, do you remember go back to your practice with CliniVRSE and this is what? So I think it also gives us accountability too, to ensure that we are also teaching skills effectively. And we're not trying to replace what's already done. We're just trying to enhance what's already done. We're trying to provide just different opportunities of learning for students, but also opportunities for faculty members, because we know it's tough out there, right? Like Dr. Gray mentioned, all of this grading and just wanting to be objective. And this is one of the ways that we could decrease the amount of grading and also be objective across the board with students and their readiness for experiential learning.
Yeah, I think I want to just pick up on something you shared, Dr. Crable, is that the concept of what a skill is versus what it isn't. And so, you know, I often say we could have 20 clinicians in the room and we're going to get 20 definitions of the same skill, which is true. So how we develop kind of what is the best versus the moderate versus the worst is going back to what is said in the original literature around each skill. And then instead of it being a correct or incorrect perspective, it's what's the range where the skill stays the skill, and then where do we get out of that range? So we weren't being prescriptive in a right or wrong kind of way. We were trying to give varieties of flavors of what, let's say, a reflection of feeling might look like. There's lots of ways to do that, but there is a point where it stops being reflecting feeling. And that's really how we approach the skills and the feedback within the system.
So from our discussion today, I'm hearing a lot of consistency. I'm hearing a lot of efficiency. And I'm also hearing a lot of elevation. So not only do we have this knowledge and the skills and we know it, we're elevating it into a place of practice, into a place of identification, understanding, and really grasping that experience, taking it in, so that the clinician improves in their own development in such a short amount of time. So tell me about the interest that you've seen in people integrating this amazing new tool in their curriculum or agencies.
Yeah. I think part of that integration is clarifying that this isn't a replacement tool. This is, to the word you use, an elevation tool. We did not design this to replace something that already exists. CliniVRSE doesn't have any competition right now because it's filling a gap that has existed. You know, there are other technical tools to help with skills that I think are wonderful. And that is a companion to CliniVRSE, or CliniVRSE is a companion to those. And I think that's an important element with CliniVRSE, and the response and reaction has sometimes been confusing about that. You know, well, we use this already. Should we replace it with this? That's not really the message we're sending. The message here is, no, that's helpful, because often those tools are helping you learn what the skill is and the structure of demonstration. This is taking that what to the how. How do we apply it, and how do we decide about it? You know, so I think there's been a little bit of confusion around kind of the purpose of CliniVRSE to some of the users who's reviewed it. And once we've given this explanation, there's almost like light bulbs going off, if you will. Oh, now we see the through line to how CliniVRSE and other tools can work together. Dr. Crable, what would you like to add?
Yeah, no, I think you said it perfectly. As a companion tool, I definitely like that, and that is elevating learning. And I think that it's just one of those tools that students, they love. I mean, the ones that've tried it out, they love it. They feel like, hey, it's also teaching me skills. I think, Dr. Gray, you mentioned this earlier, that, hey, I will eventually have to sit for 50 minutes with the client, and what does that look like, right? And it provides them the opportunity to get as realistic as they can prior to getting into something, sitting in front of a real client. I mean, we put them in front of their peers, but they role play for about 15, 20 minutes. And then sometimes the peers, you know, they give them something. Hey, so you need to do that reflection of feeling now. Here's what I'm going to say so you can do it. And this doesn't do that. This doesn't give them an out. It doesn't save them. It's, hey, use those skills, apply those skills that we have taught you, and use them effectively.
Yeah.
So as an innovator and a creator, and that's what you two are, what was it like for you to create such an amazing resource and tool for students?
Yeah,
You both sighed. You both took a big deep breath, both at the same time. So tell me that feeling. Put that into words.
yeah. The feeling now is, it's amazing, because you always want, well, for me, I must speak for myself, like, contribute back to the field, right? The field has given so much to me in my learning process, and being able to see 20 years, 22 years later, like how it has evolved, and to be a part of that, it was all worth it to me in the end. Like, there were some things with anybody who innovates and create things, they're going to have, their days, their challenging days, but we always kept it like, hey, this is for a purpose, and purpose is for students, for the field, for our clients, for faculty, our colleagues, and so it feels amazing to be able to contribute to that, and have CliniVRSE be at the end of it.
Yeah, my sigh is along the lines of what you just shared, Dr. Crable. The focus has always been filling a gap to make sure we have the best clinicians for the public. That's really been the focus. And that's really, what we returned to when we did have those moments of like, oh, this is a lot of work. This is a lot of effort. This is a lot of energy. This is a lot of time,
Yes.
But we kept reminding ourselves that, no, this is actually going to help people be more effective clinicians from the start, after they graduate, or when they're newly in their profession, before they're licensed or credentialed. This is an opportunity where we can have a trans curriculum tool. You know, this isn't limited to a specific course or a specific experience or a specific concept. It's something that you can use over a period of time. And that was the other element. We're giving greater opportunity in an asynchronous way where it's not taxing all of the other systems that are already taxed, like everyone's time, students' time, faculty time, program time, agencies' time, supervisors' time. We're all taxed so much with that. We kept focusing, this is going to be a way to help people decrease that, but still enhance and elevate the opportunities and the skills of new clinicians.
Mm. Yeah, it's not a shortcut. Like, it's definitely not a shortcut. It's students really have to be present in the moment to make those clinical decisions.
So as you see this grow, this amazing new tool, you've taken the time to develop it. Both of you have really poured yourself into this and making sure that it benefits the field. As this grows, where do you see it going? And what are some maybe new pieces that you hope to add or updates along the way for the next version?
So CliniVRSE is based on a 10-session module. So there's 10-hour-long sessions in a module. So right now we have our foundational module that is focusing on conflict-based anxiety. The next phase is to add more 10-session modules around other specific topics. So, for example, depression or other types of anxiety, and how we can expand those areas. So that's kind of the first layer, if you will, of the next phase. But I do see us expanding as technology is expanding very quickly, integrating some of those other tools. You know, right now, CliniVRSE is designed to be virtual reality, but we're starting off with the baseline using an online platform as opposed to having to have the VR glasses. So that'll be the next layer in terms of the technology to make sure that then those who want to use it through the virtual reality goggles, if you will, then they can use that. You know, we may move into AI work as well. We'll see how the future comes. We don't want to rush into that, of course. But it's really focusing on how can we get other topics and expose learners to other areas of work and how these skills can be used. We've even discussed at some point also then establishing some specific modules around focused types of treatment. So if there's a theory or a therapy that a student wants to learn about, we have a specific topic, but then we're using not only skills, but then integrating specific interventions from those theories and therapies. So those are some of the areas that we've talked about expanding. Dr. Crable, what else would you like to share on that?
Yeah, and I think we also talked about using assessment tools too, like training for assessment tools and being able to like crisis intervention, assessing for suicide or homicide. Like we do those things, we talk about those things, but we don't necessarily get into, and we can't get into it like we could because students with mock sessions and those things, but really training using CliniVRSE to train on assessment as well. And I think in addition to all the things that Dr. Gray mentioned, I think the sky's the limit. I mean, honestly, for us, and we're always looking to evolve with the field. And one great thing about the field is that it's always evolving, and it's important for us to be a part of that.
So as we leave those listening to this today and watching and interested, as we leave them, what's the one sentence that you would say, this is the reason why you should come try this out? What's a one sentence?
Good question.
I would think I'm going to answer from, and then maybe Dr. Gray, you could answer from a different perspective. But I think from a faculty perspective, I would probably say, come try this out. You have more time for self-care. You're doing less reviewing of tapes, something like that.
Yeah. Yeah, when I think about that question, I think about going back to kind of the purpose that April and I have shared about why we created it. And come use CliniVRSE because you will be contributing to elevating clinical work. You'll be contributing to elevating those who participate in clinical work. You'll be contributing and supporting growth in learners that may never have really been integrated into many programs. So if you want to elevate the skill level work and the application level work for your learners or yourself, try CliniVRSE.
Yeah. And if you want to be an innovator, try CliniVRSE.
Oh my goodness. There's so many, it sounds like there's so many ways that it's beneficial that it's almost hard to sum it up in one sentence. It's almost hard to pull in all those elements because your vision has been so big. As we kind of leave, what's the next step? Someone says, I'm interested. I want to know more. I want to dive in. What's their next step?
So the next step would be reaching out to the publishing company and reaching out to our representative, and they will get the process going. So CliniVRSE is a subscription service. And so the subscription is a 12-month subscription. So you have access to all 10 sessions for 12 months, for a whole year. And that way you can practice. And if you don't feel comfortable after you've done a session, you can go back and try it again. So reaching out to our publisher and establishing a subscription. If you're a program administrator or a faculty member and you want to integrate it into your classroom, it's the same process. However, we can do an added level of integration to support you in that process as well. We do have some additional features that we can customize to your program. If you're interested in really committing to CliniVRSE for a longer period of time, we're more than open and willing to work with you to help customizing our modules to what you need in your program. If you're willing to make a commitment, we're willing to make a commitment to you.
And we'll make sure, oh yeah, I was just going to add that we'll make sure at the end of this video that you have all of the publishing information and the website for CliniVRSE.
Awesome. Thank you both today for talking about this. Is there anything that we've missed that I haven't asked that you say, I want to make sure that the audience knows about this because it's beneficial? So anything that we haven't touched on, I want to give you a space for that.
Something that, yeah, go ahead, please.
That's right, go ahead.
Something that comes to mind is we've talked a lot about this being for learners and new clinicians, but I think it can also benefit those of us who are seasoned clinicians who maybe have been focused on an academic career and not so much in a clinical career. And, you don't use it, you lose it. And so this is also a tool for those who may have committed to an academic career who don't see clients any longer and don't have necessarily the sharpened clinical skills that they once had. This is also a way to kind of brush up and re-hone your skills. If you're educating students on how to use skills and not using them in practice, this is another way to help make sure you're practicing in an asynchronous way on your own time without having to add another business or another job or another workload to yourself. So I think that's another use or purpose of CliniVRSE that we didn't really mention today, but I think is very valuable. Yeah.
And I was going to say something similar, but related to supervisors too, because some of us supervise, but we're not doing any clinical work at the moment. And it's a great way to brush up on your skills. Yeah, because you have to. And how you're going to, like you said, how you're going to teach it if you're not doing it yourself. But this is a great way to just keep honing in on your skills, to keep practicing, to keep them sharp, to keep them fresh, and to learn new things. I think we all learn new things. We shouldn't ever stop learning. And one thing that CliniVRSE does is that through the sessions, I know I've learned some things just in the responses and like, hey, why haven't I been using that skill all this time? So yeah, I think that it's perfect. It's just not for new learners.
The interesting piece from today is there are so many places that this touches. It doesn't just touch just not a novice counselor or student or learner. It doesn't just touch in one single specific area. It literally moves all the way through and can be beneficial to almost every part. So remarkable work. Thank you for sharing today, and thanks for going through this. And for those interested, the information will be attached to this video.
I want to thank you, Dr. Stewart Spencer, too, for joining us today and creating this opportunity for us to talk about CliniVRSE. So thank
Yes.
you.
Thank you.
Thank
guys.
you.